story I want to share today is about the work that we're doing, a community health needs assessment in partnership with the Alaska Black Caucus. Now, if you look at the CDC data, you might think at first that there are no black people in Alaska. Well, there are. About 3% of the Alaska population is actually black. And so, but if you look at the data, none of that comes through, because the data suggests that about, especially as it relates to COVID, about 34% of the cases, just by reading that data that came from CDC, showed about 34% were either other races or unknown race. And so that was labeled as such. And so when we looked at the data, we thought, wait a minute, something is wrong here. What are those other races? What is that unknown race? And so what the Alaska Black Caucus thought was, let us collect data that is specific to the black community of Alaska. And that was the starting point for the work that we did. And so they reached out to the University of Alaska, and we partnered on this research project to look at understand some of the health challenges and needs for the black community, and hopefully fill the gap in the data, in public health data that exists, and that would hopefully be specific to the black community and help the hospitals and health providers when they are working with the black community of Alaska. We want black people to be recognized, to be seen, and to be heard because they exist in Alaska. But if you look at the public health data, you may not see that. And we hope that the work that we have done will contribute to closing those gaps.